let's talk a little bit about the reasons why a physician might be unhappy where they are currently working. So I basically break this down into four categories. Essentially, you can be unhappy because of the financial situation, you can be unhappy because of the emotional situation, or you can be unhappy for not striking the right balance. And I've encountered two types of balances. There's kind of the work-life balance, and then there's the risk to work balance, or the two balances that usually people get caught up in. So let's take a look at each one of those and kind of consider the different reasons why people look to make a move from where they currently are. Starting with the financial issues of being a doctor is probably the easiest one to get out of the way first. So the average salary for most physicians, it varies a lot by location and by what your specialty is, but it's around 370, 380, I think is the quoted national average. So if you are on the low end of that, let's say you're in the 300s around, and assuming you have a family, you're trying to take care of a family, and the government is probably going to take in tax revenues about a third of that. So that goes from 300 to 200, and then if you have kids in private school, that can be, on the steep end it can be 30,000 per kid, and on the lighter end maybe 15,000 per kid. But assuming you have 3 kids, that could easily be 50,000 and above. And then, assuming you have a mortgage on a house, you're going to be paying probably on the lower end. You're going to be paying about $5,000 a month for that. So there's another 60,000, and that's now you've got $100,000 that is remaining. And then if you want to add to that, two-car family, the payments for that will typically be probably about $20,000 per year. So you're already down to about $60,000 or $80,000 of what you started out with. And you haven't bought food yet, you haven't bought clothing yet, you haven't done anything yet, you haven't paid any of your utilities yet. So it's not hard when you place yourself essentially in the environment in which probably most physicians imagine themselves affording based on, when they were kids, seeing adults who were physicians and how they lived. You can see that at the $300,000 level, you're probably not having much left over for things that you want to do. You're basically just hitting the basis of things that you feel required to do. And that could be one of the reasons why people look around and say, is there another better way to do this? I think the second reason why people really find themselves unsatisfied with their current situation can just be emotional, and for very valid reasons. And I think included in that category is the idea of not feeling fulfilled in what you're doing. Perhaps you're in a situation where the demands of the job are you see X number of patients a day and it leaves you with just a tiny amount of time per patient. You don't really feel like you're fulfilling what you would imagine to be an adequate job to connect emotionally with each patient, make them feel like they're being taken care of, and actually do the task of taking care of them. And that's when you have 5 minutes per patient, it's really hard to hit all of those goals, and people can feel unsatisfied for that reason. There are other reasons why, just emotionally speaking, sometimes the job you're currently in doesn't connect for you. Maybe there's an enormous staff and there's continual staffing problems. Maybe there are other reasons why it just is not a good fit and you don't feel good at the end of the day. I've had experiences where I've been in practices where there were equipment failures and there was just poor management, and essentially part of the job was being the apology unit for the practice, like, oh, I'm so sorry, that's not working today. That can be really difficult too. There are many reasons why you just may feel bad at the end of the day, but that's a very valid reason to want to think about doing something else. The third common scenario that people run into is just where you can be satisfied with your job, but it's taken over everything. So in other words, you're feeling a sense of fulfillment, you're doing great, you're happy with the way that you're taking care of patients, but the problem ends up being that you don't have any time to be at home, you don't have any time for anything outside of your job. So even though your job is hitting all your strict criteria for what you want, there's no time left over for any other aspects of your personality. You don't have any hobbies, there's not enough time for your family, etc., etc. And that's one of the reasons why people can even be in a good situation and feel like it's time to do something different. The last situation that I think gets to people, and I don't think this has really been discussed, and I don't think a phrase has really been coined for it yet. I kind of think of it as the risk to benefit ratio of the practice, is that, sometimes you can be in a situation where you're in a good situation and feel good about what you're doing, but especially if you're in a surgical field, you can be in a situation where you get to a high volume where the actual financial benefits per procedure just don't seem to fit a general picture anymore. So, for example, in my case, and you can apply this to your specific specialty, but in my case, doing cataract surgery, an insurance-based cataract surgery pays about $500 nowadays, and it's been toned down a lot over the years. And even if you're doing many of those every day, you're essentially performing a surgical procedure, and for the next 90 days you'll take care of that patient without any additional payment. And any patient that you do that surgery on can call you in the middle of the night if they're worried about something. Any patient that you do that for can request an office visit to come back in and have you check on them, and that's rare, but it can happen. And what it boils down to, if you're doing those procedures at a 70% overhead for a $500 procedure, what you're really getting for each surgery is about $150. And then if you think of a 30% tax rate, what you're really taking home from that is about $100. And that means for $100 you've essentially performed a surgery and are responsible for all the outcomes of the surgery, are responsible if anything goes wrong, and are responsible to each individual person that performs that surgery for 90 days without any further payment, to answer an emergency phone call, to take care of anything. And that's all zero payment after that initial $100. So as you get to higher overhead levels, some people begin to feel like, yes, I'm doing a ton of these surgeries and I'm getting great results, and I'm putting together an income on the basis of this. But when you think of each individual risk to benefit ratio, it can feel like something is unmatched. So I think that's another reason why people continue on into higher overheads with more staff, more help to do more procedures for more patients, and yet at some point things seem to misalign and they don't feel like it's working in their favor anymore.